cause of the fibroid is unknown. It's not clear. But he has some theory, it's invocation that the stimulation, the growth of the fibroid in the uterus. One of them can be the hormone. The hormone progesterone and estrogen is produced for the ovary, and this increase of the hormone of your body can produce the stimulation of the uterine fibroid. Another causes can be the familiar history of fibroid. If in your family you have your mother, your sister, your grandmother have fibroid, you will be candidate to develop fibroid in the future. Another is the pregnant. When you are pregnant, you see the hormone progesterone and estrogen is increased in the pregnant, because this is what is helping the fetus grow in the uterus. But if you have any fibroid, can stimulation the fibroid too. If for this reason you can find sometimes pregnant woman with the fibroid, as the pregnant is developed, the fibroid can grow too.
Okay, thank you very much. And mama atretre mu no was say a year fibroid in to me de bapa de want to me entre mu ensiase na emum ni wonim ene se wo mama bi wo bi wonia ba bi wo bi wona nankan so bi wo bi weni atwem se wo anase atwem wo so wutumi enye bi ene wo ba se wo fefra wutumi enya eye kokrami bi enu ti no ehu behia se wo bekọ ayasabia na wakwakọhwe wapomode ho ensem titiru se wonyem wo fefra wo ba bomodia ema wonan enye ntietia wayasabia se de beye a enyema bi sei no wo dokota betumi ahwe na wesi ano ede amawo. Doc, as we move to our next question, we would like to know the different types of fibroids we have.
Okay. We have different types of fibroid according the location where the fibroid is. We can have subserous fibroid, if the fibroid is grow under the serous of the uterus. We can have the submucous fibroid. If the submucous fibroid is growing inside the cavern in the lining of the endometrium is. We have intramural, if the fibroid is grow in the muscle of the uterus. We have the pediculate fibroid. This pediculate fibroid is grow outside too, but it has some small pedicule or the sting, or thin sting, like it's like the base. Is the fibroid is grow outside, is sometimes you see it grow like the shape of the fungus or the monstrous. Monstrous.
And a mame atretre mu amayen no was this fibroid no ye wo mu miensa atrese eno no wo betumi enya nti ne hia ene se wo behwe wo hu eyie ebitumi fifi e wa awodie nim ebitumi fifi wa awodie no ho trese fibroid de etumi fifi wa gwakwa no ba bia enu nti ehu behia se wankasa nso se nipa da seni no behwe wadidie mu yie wunde mu yie ade a wo ye biada no wo behwe wo hu ye se de be ya yareboni wo yare untumi enkonkofe bi enfema wo hu. Doc, on our table today, we would like to know who really is at risk to get fibroid. At what age, at what time, who exactly is at risk to get this fibroid?
It has a lot of factors that's contributing to the risks of the fibroid. One of the factors I tell you is a familiar factor, hormonal factor, the age. You see, age with his growth, certain year or more older, the nullipara woman, that woman, he never has children. The people have the early menstruation or early menarche. The people has the late menopause. You see, it has some environmental factors. It can be risky for the fibro too. Like some people is invocation the deficit of vitamin D, the toxin. Another risk for the factor is the obesity. The obesity of the woman. Yeah.
Okay. We thank you very much. And yet say mommy watch church muno. Was say a year fibroid nipa wo betumi enye bie. Ye di kan ekan ye say wabusuani bi e wo bia wutumi nya. Ai emfa ho ne mfie dodo a edie say wewu kra na wote ase wonso wutumi enye bi. Ena nipa wo so dodo nipa wo so obese wo so dodo wono so etumi nya eye fibroid bi. Ena nipa wontumi wo ba ya waba asase so a wontumi enwo won woda wono so etumi enya eye fibroid ebiem. Ena fe so eye aketesi a wesi so emre so se wobu ne nsa na nso no wabu ebi ti say 10 years 11 years 12 years no wabu ne nsa eye ntem dodo enu nti wono so ebetumi enya eye fibroid bia enya de say de nti no wo wo kwa no hwehwe wa pomudi mu nsam ye se de be ye betumi aboa na wankasa nso wenya che e wa akrati asefo asase so na enchini aye die wo so wetumi edibi ache. Mommy, what are the symptoms of fibroid? How can one know?
Okay. The symptoms of the fibroid, the pain of the number of the fibroid, the pain of the localization, and the pain of the site. You see, you can have a heavy you can have your menstruation with heavily fluid and painful. You can have abdominal pain like lower abdominal pain, back pain. You can have constipation. Constipation, why? Because when the fibroid is so big, it can compress the rectums, you know. If you have constipation, you have problem when you go to urinate. You can urinate frequently, or it's difficult to empty the bladder completely. Why? Because the fibroid can compress the bladder. It can give this symptomatology. Entonces, another matter too is can prolong your menstruation, can give anemia, prolongation of the menstruation, and all this fullness of the pelvis.
Okay, we thank you very much, Doc. And yet say what church muno was say a symptoms near be ya who say fibroid wetitimbi. And say wubu wonsa moja ne ba bebre afen so nkotoa ewo moja nim wo bleedi moja ba enkotoa nso so na emu enye eyi enkotoa ketewa na afen so wo fa wo yaw mu wo te ya wankasangasa ewo sabi wase se eye wo ya ubu wonsa de moja ne ba enso eba bebre na na esanso eye wo ya eno etre se wonya eye fibroid bia afen so no se waso se wo ware a wo ne wo keni ehia wo te yaw ewo eye empemogram di no ehu eno so etre se wetumi enya fibroid binti no eno ase obeye ententem no wape ayaresa biabiara ebenwo na wakwa hu doctor no de wafa ntrechre mu na waye ne sefata sede beye a fibroid are wo betumi eyi edi afi ho amawo na emfa wo enko ensie do ya. Doc, how can uterine fibroid be diagnosed?
Okay. When you go to diagnose the uterine fibroid, advise go to see the gynecologist if you have any of the suspects. And just the gynecologist he go to do the examination of the pelvis to see if it has any deformation, to see the chart of the uterus, if the uterus is increased. They can have many tests. They can confirmation this diagnosis the fibroid, like for example, the traditional ultrasound scan for a transabdominal or a transvaginal ultrasound scan. And just for the confirmation, sometimes we want another test is can do more details about the fibroblasts, MRIs, is the resonance magnetic imaging of the utero, when you can see the utero in better condition, the localization of the fibro, if you can see the characteristics of the another tumor. We have to the CT scan. For the CT scan, you can guess this another test. We can do hysterosalpingography. Okay. What is hysterosalpingography? Hysterosalpingography, you take the contrasted substance and you inject so the vagina to the cervix. If you do the X-ray, you see the shape of the uterus. You can do by hysteroscopy. Hysteroscopy is some hysteroscopy you introduce from the vagina to the cervix. It has one light at the end. If you can see the uterus inside the cavern, it has myoma submucosal or don't have. You can do by laparoscopy too. You can do for laparoscopy, and you can do. It has some another method. Is sonography. Okay, this is you take the one catheter, you put inside the uterus, you fill in the cavern with solution saline. You can see the uterus inside.
Thank you very much, Doc. And yet, said Doc, watch a tremuno, your wapatre, ain't nada, and it say, to me, a gynecologist now, what the wafa ye, what examine, what the wash shall say afa, and tremu, ayaresa, process no, what the wash shall say afim, said a bear a bit to me, a see, and no quine, I no, a here papa. Na a year numbers ya me de ba be to dwai se wo adwentre bi wo wasem bi a wo pese wo de fa a year yeso ebisa na doc etumi